Association of adjuvant chemotherapy in patients with resected pancreatic adenocarcinoma after multi-agent neoadjuvant chemotherapy. The total number of patients with pancreatic ductal adenocarcinoma, PDAC, who receive neoadjuvant chemotherapy, NAC, is increasing. However, the added role of adjuvant chemotherapy, AC, in these patients remains unknown. To evaluate the association of AC with overall survival, OS, in patients with PDAC who received multi-agent NAC followed by curative intent surgery. This retrospective, matched cohort study used data from the National Cancer Database and included patients with PDAC diagnosed between 2010 and 2018. The study included patients at least 18 years of age who received multi-agent NAC followed by surgical resection and had available records of the pathological findings. Patients were excluded if they had clinical or pathological stage 4 disease or died within 90 days of their operation. All included patients received NAC and underwent resection for primary PDAC. Some patients received adjuvant chemotherapy. The main outcome was the OS, overall survival, of patients who received AC group, versus those who did not, non-AC group. Interactions between pathological findings and AC were investigated in separate multivariable Cox regression models. In total, 1132 patients, mean age, 63.5 years, 577 male, 970 white were included. 640 patients were in the non-AC group and 492 patients were in the AC group. After being matched by propensity score according to demographic and pathological characteristics, 444 patients remained in each group. The multivariable Cox regression model adjusted for all covariates revealed an association between adjuvant chemotherapy and improved survival. Hazard ratio was 0.71. 95% confidence interval was 0.59 to 0.85. P-value was less than 0.001. Subgroup interaction analysis revealed that adjuvant chemotherapy was significantly associated with better overall survival. It was 26.6 months versus 21.2 months respectively. P-value was 0.002, but the benefit varied by age, pathological T category, and tumor differentiation. Of note, adjuvant chemotherapy, AC, was associated with better survival in patients with any pathological N category and positive margin status. In this cohort study, adjuvant chemotherapy following multi-agent neoadjuvant chemotherapy and resection in patients with PDAC was associated with significant survival benefit, compared with that in patients who did not receive adjuvant chemotherapy. These findings suggest that patients with aggressive tumors may benefit from AC to achieve prolonged survival, even after multi-agent NAC and curative intent resection. Is there a survival benefit of adjuvant chemotherapy in patients with pancreatic adenocarcinoma after multi-agent neoadjuvant chemotherapy? In this cohort study of 888 propensity score matched patients who received multi-agent neoadjuvant therapy, patients who received adjuvant chemotherapy survived significantly longer than patients who did not receive adjuvant chemotherapy. It was 27 months versus 21 months respectively. The benefit varied by age, pathological T category, and tumor differentiation. The findings of this study suggest that the use of adjuvant chemotherapy may be warranted, even in an era of multi-agent neoadjuvant chemotherapy, especially for aggressive tumors.